Let me get Becky in here. The state representative, House of Representatives, Becky Currie. Becky's domain is Copiah County, District 92, Copiah County, Lawrence, and Lincoln counties. And she is also chairperson of House Tourism Committee, which is a very, very important assignment there, and vice chair of House Rules Committee. Becky, good morning. Well, we were worried about you the other day. We really were. We were about to put out a silver alert or call Sean at the Highway Patrol at Department of Public Safety and say, go look for her.
Well, you know, when I get in the car on Monday morning, my car just goes straight to work, and I have no idea. I just went straight to work. So I apologize, but I have to tell you, it's worked out better because today the Senate is having a hearing on this Medicaid issue this morning, and I think it's probably a better day for me to be here to talk to the people because the House passed this bill, and it is now in the Senate's hands. I know you probably want to fill them in on what we're talking about.
Well, the Centene, and I think most people understand this. I did get this note here. It was a big story in Ohio Capital Journal, and the story just talking about the Centene chief. The Centene chief makes as much in a year as 1,409 of the best paid of the 25 million Americans for whom his company manages Medicaid benefits. He makes $25 million a year. He is the top paid country's top paid healthcare executive. And it goes on and on and on. But I tweeted out yesterday 2 pictures on a tweet. One was of the new unbelievable ice hockey arena in St. Louis. And guess who has bought the rights to that? Centene, with our money.
With our tax dollars.
And the other one was another facility, and I forgot what it was, but it was another big facility that they've spent some money on the naming rights, and again, with our tax dollars in Mississippi. So you had a meeting yesterday, and I'll let you tell me about that with a member of the Senate, but what do you think this bill is now?
Well, they're having a hearing, and I think that they're going to listen to both sides. And you know, when somebody takes $55 million of your money, let's just use an example. If you went to a mechanic and he charged you $5,500 more than he should have, would you go back? And the answer is no. So that's really what we're trying to do with this amendment. Yeah. And the House spoke overwhelmingly. There was zero no votes to doing away with this contract and moving on to a nonprofit and just making sure, you know, I've been a nurse for 43 years, Paul. I've taken care of sick, elderly, disabled, and I don't think anybody minds spending our tax dollars on people that need help and who can't care for themselves. Special needs children, people that are on insulin, you know, they're not being able to get their medicine because Centene is denying care. You know, right now our hospitals are about to fold under this pandemic, and we need nurses. And if you are a healthcare professional and do not call the Capitol today and let them know that you want the Senate to pass this bill with my amendment in it, just all you have to say is do away with Magnolia Medicaid. We're missing a huge opportunity, and I cannot do this alone, one person. They need to hear from their voters, and the phone number is 601-359-3114. And call the lieutenant governor and call your state senator because it is now in their hands.
That's it, and it would be powerful. Every call is amplified 200 times.
That's exactly right.
That's the equation that we've learned as far as broadcasters are concerned. And well, let me say this also. Centene put out almost $500 million. Total spend of $4,776,725 on paying legislators to make sure they see their point of view, and another $5,460,000 to pay lobbyists to also influence the legislators. So altogether, about $1 million Becky, from my understanding, gets how much money from Centene?
Oh, I get zero. And Paul, I don't want any money from Centene.
I understand that.
You know,
I just wanted people to know that you're one of the few legislators that in a power position or chairman that does not get any money from Centene. So, the concern, and I was on the phone yesterday talking to some folks who really want this to happen, and I think they have a growing number of people in the Senate also of like mind. There is some concern of how we do this as far as the mechanism, the minutia behind this to get this up and running. So at the end of the day, what we want it to be is saving taxpayers in Mississippi money, but the first and foremost is better health care.
That's right.
Are you concerned how we do this, how we formulate it, how we get it going?
I'm really not, and I'll tell you why I'm not. I was here when it came to be, and we had to go through all of the computer changes. We had to go through all of the changes for their care, and not one person that I'm aware of went without care. You know, if you have Medicaid, if we could get rid of Centene, you will end up with more care because they're denying your care right now. You will end up with better health care when we don't send all this money to St. Louis, Missouri. You know, and I understand they're also building a brand new $1 billion facility in another town. So, you know, let's just be real. We want to take care of our sick, mentally ill, elderly, and we want to be able to say that our money is being spent right, and it's just not. And we just, if we don't, this is the time to do it. I'm not sure that we'll have a time like this one.
Yeah. You said something on the floor that you said, you know, people need to know this. Centene they don't cure anybody, they don't help anybody, they don't do anything other than what they do is they take all the money that comes in from Medicaid and the federal government's money and our money, and what they do is they make a decision whether you get those tests or not, and they're supposed to be judicious about it, and that was supposed to make sure that we get better health care and get healthier as a people. But what it does make the equation, the equation does is make sure they have a better bottom line. Their bottom line's the only thing that gets healthier.
That's right. And let me tell you a quick story. A friend of mine who is a doctor who Centene had a list out saying that he was the highest number of, he ordered more scans than any other doctor in the state. And so, you know, it bothers doctors when they're outed as being the heavy spender. Well, so here comes a patient who needs a scan. He doesn't order it. The patient has cancer, and the patient sues him. For the first time in his life, he gets sued. And you know, we just can't do medicine like that. The doctor needs to be able to order the tools to take care of the people. And, you know, it's just things like that. You know, if you want socialized medicine, keep Centene here, because that's what you're going to have.
Want to switch to talk about tourism in a moment. We'll wrap up the Centene equation and go back to talk about the tourism with Becky Currie. That's coming up in a moment or two, right after a quick shopping break. Becky, they want you to give that phone number out again for the Senate. Because, let me say this. I did get a picture this morning, and that picture happens to be of the committee room. It's packed early this morning waiting for the hearing, and according to my sources, the vast majority of those people there are Centene executives or workers or potentates who are not on the job but are protecting their job at the state Senate.
That's right, and there's plenty of jobs out there. We're not going to let anybody go without a job, but the only way I can look at all of them being there is at least they're not back at work denying care for our most precious people.
All right, we're getting so many people trying to figure out what the governor's announcement is going to be this morning. We just had somebody said maybe something about Nissan, maybe something about. I have no idea. Do you have any idea? The governor said stand by a huge announcement. I
wish I knew, but I do not know. That phone number again is 601-359. 3114. That's the Capitol line. Just ask for the Lieutenant Governor's office or send a message to your state senator.
Just all you got to do is call 601-359-3114. Takes you 5 seconds. But when she answers, the nice lady say, I want to send a message to Senator son, my senator, and I want you to say this.
I want you to say it's time to end Magnolia Medicaid. We're tired of them ripping us off.
Time to end Magnolia Medicaid. I think that's the good thing to say. But we do have plans. I know the Mississippi Hospital Association has something called True Care, and there are other people out there. Is there if the Senate votes on this and the governor signs it? Is there another bill required to take this to the next level, to have that approved, or some mechanism to have this fill in? And do we have time to do that?
We do. It's all in the bill. I made the amendment where it goes into effect upon passage, and we're set up to do this. So it's not going to be any people that are going to lose care in the meantime. Mm-hmm. Don't be scared of that. You mentioned $55 million that we sent. The $55.5 million was the settlement that they paid us, which was one of the largest civil settlements following that investigation by the auditor and the attorney general. The $55.5 million, I think Ohio got $84 million, but we had to say, I think before we could get it, we had to say that they did nothing wrong, but they overcharged. But in this story, our division of Medicaid has paid out over $1.1 billion to these people, Centene, in a 4-year period between 2016 and 2020 for pharmacy services, and that's, if you divide that by 4, that's $275 million a year. That's correct. And it's not just this one thing. Like I said, they deny care. They don't pay our hospitals. They don't pay our doctors. They're not paying our mental health. Whatever money they deny claims for, they keep. And so it's a lot more than just the pharmacy benefits. I believe the pharmacy benefit, $55 million, of course, brought a lot of attention. But as you know, Paul, I've been saying this for 10 years. This is not a new subject for me. I've known that it has hurt our health care across our state for a long time, and it's just time to do something different. When you do the same thing over and over and over, and it isn't working, what they say, signs of craziness if you continue to do the same thing.
I don't want us to run out of time here because this is important too.
All right.
And as many people are saying, it is time in this legislative session for the state legislature to pass a bill to create a division of tourism and get that division of tourism on board to kick this up in a way that it needs to be done on their own, full attention for the 4th largest revenue producer to the people of Mississippi, and that is tourism.
And that's right. We have a division in Mississippi Development Authority.
Right.
And do we need a new state agency? A lot of people think we do. That is at the end. I think that we'll probably end up doing that. But, for taxpayers, that is starting a new agency, starting a new board, starting a new executive director. So we just want to be careful that we're spending our money in the right way. We just started giving tourism dollars, the dollars that they actually need. They bring in $6 billion a year to the state of Mississippi, and we've been doing pretty well during COVID. People have come to Mississippi. We were the number one in the nation of renting hotel rooms during the pandemic, which is just an unbelievable event. But we just need to continue down that road. Louisiana is outspending us, Tennessee, Alabama, all of our neighbors, and we have a lot to come here and see. Now.
Yeah, I'm sorry. I don't want to run out of time.
I understand.
The other big part of this is, would you agree that we need to move the parks to tourism?
Well, I would agree to do that if they fixed them first, but I can tell you tourism doesn't have the dollars to fix the parks.
Well, so, that would have to come with the appropriation.
It would have to come with the appropriations,
sure.
And then I believe that we would have to do it because the Wildlife and Fisheries is not advertising them and doing the things that they need to do.
I understand. I could say from the private part and private sector and having conversations with people, the worry about the expenditure of a board and the staff itself would be minimized, because I think it would pay for itself having them on their own. And I think they are the ones at a division of tourism that could handle the park's marketing, booking, and everything else. And that will allow MDA to do the things it does best. But I hope that happens. Did I see where that bill died in the Senate?
No, it has moved to the House. So
the tourism bill.
The tourism bill is alive and moved to the House.
Very good, very good. Anything else you want to mention here?
That's all. We've got the rodeo this week, and I sure hope everybody comes. It's been record numbers there, and they've got a lot of great events. So, come spend your tourism dollars right here at the rodeo.
A great venue now, better than ever as far as the new and improved trademark. Man, it's very, very nice.
Andy's doing a great job.
There was one other thing here, and I guess we'll catch you on the other side, but there's a deadline coming up, and that deadline is it this Thursday or next Thursday?
Next Thursday.
Next Thursday.
Mm-hmm.
Next Thursday on the deadline. Becky, thank you. Appreciate it. I know when you leave here, are you going to be at that hearing? Or
Well, it's going on now, and chances are there's no room in that hearing room to get in. But
no, I saw the picture a few moments ago.
Yeah.
If it's 100 people in there, how many do you think are Centene people?
Well, according to my sources, most of them. Nobody else has been able to get in the room. So please, everybody, please call your state senator. I can't tell you how important this is.
I will tweet the number out, but the Capitol switchboard number is 601-359-3114, and I'll send that out in a moment or two because I've had more people ask me about that. At Paul Gallo Show as far as the Twitter account. Becky, thank you. Appreciate it very much. And we're so glad to know that you're okay.
I'm fine.
Take care.
Thank you.